You are listening to Massage and Fitness Media, Episode 4. Recently, I had seen a lot of mentions about telehealth, a way for physical therapists and other healthcare professionals to continue to provide care for patients in pain remotely. So what exactly is telehealth and how does it work and why should patients care? So today we have Dr. Sandy Hilton from Chicago, Illinois, who is a pelvic pain specialist in physical therapy. And we're going to do a little role playing on what telehealth is and how it works. And so, let's pick her brain.
So I love that I got the message that said this is voice only because I was like, I could put my hair in a ponytail. I could just leave it and then I saw that and I was like, oh, good, I'm done.
I like ponytails. Hey,
Well, that's where it
that'd be
is.
nice.
That's the off my face.
Yeah.
Doesn't bother me, hair.
Well, yesterday when I went out to get some medicine at Target, I walked by several nail salons and beauty shops and hair places, and they all closed.
Yes.
And I'm just wondering, what will people look like in 4 weeks if they were to not groom or try to groom themselves, have someone else do it for them, like a partner or their kids,
It's gonna be probably a steep learning curve, and
Mhm.
I predict that a bunch of women 40 and older are gonna decide that going natural is not a bad thing.
Yeah, that would be
Uh,
awesome.
and and that we're gonna get our flexibility in by trying to do our own pedicures, because you have to be able
Hmm.
to comfortably touch your toes and all of those kind of
Hmm.
things. So, yeah, there will be changes. Yep, that's one
Well,
of the bigger ones I think for people who are used to routines of self-care that now
mhm.
are going to have to self-care their self-care.
Yeah, pretty much. I may have to go back to using my mom's. Gosh, I don't know if my mom still has it or not, but back in the mid '80s, my mom used to cut my hair,
Uh-huh.
and I was about 8 or 9 at the time, and it wasn't that good. I mean, there are some pictures to prove it, but
I did that to my children too, so yeah, I get it.
yeah,
Mm.
it was like a typical Asian bowl cut, you know what I mean? But but it was the easiest thing to do. I mean, which makes sense. And but she got this comb that has a razor, like a shaving razor, planted in there.
Oh yeah, they use them for for thinning hair. Yeah,
Is, is that still around? I mean, that was
I
made in Japan. She
I
got
think
it from
so.
Japan. Okay.
I think so, but
Wow.
should definitely get one of those. I lived with my adult life has been with military people, and the
Uh-huh.
guys just shave their heads. So I mean there's always been a a, a full on barber kit
That's
around. So I guess if I get tired of long hair, I could just shave mine.
yeah, you would probably look
Like,
I don't know.
this is looking a little ratty. I think I'll shave
Uh-huh.
my hair. Actually, Carolyn Silvernail has a beautiful video out somewhere. She's got
Ooh.
this gorgeous long curly hair, and somewhere she did a video where she was trimming it herself and how to do it.
Mm-hmm.
It turned out fabulous. So I might have to hunt that down if it gets to it.
Please share it somewhere on social media. And if Carolyn and is listening to this, I would love to see a video of you grooming Jason Silvernail's hair. That'll be
Does
pretty
Jason have
much.
hair?
I'm sorry.
Does Jason have hair?
He has hair, yeah, but it's very, very fine and very short, as far as I know. In fact, if you look up some of his pictures he posted back when he
Oh,
was a teenager,
a young
yeah,
boy. Yeah.
yeah, he has. That was like, wow, that's what you look like with hair. I was very amazed. He looks really good.
I love all the video things of
Looks,
or the pictures online of people like the docs who are having to shave their beards to get fit with the masks. And there's this fabulous series of before and
yeah.
afters.
Uh-huh.
I totally show my age because they all look like they're 12 when they shave.
Oh wow.
It's like, oh, you look like mid 30s. Nope, you look like you're 12. It's
Wow.
it's pretty funny. Yeah, this is going to change society and social norms and all
Hmm.
kinds ways.
That's good. We're making history here. Who knows what we'll be doing in 100 years and look
Hey,
back
and the
into this.
beautiful thing about humans is we evolve, man. We
Mm-hmm.
get these kind of challenges and solutions are made, and
Mm-hmm.
we get better at things when we need to. This has kicked my butt in some really good positive ways just in 2 weeks.
Mm-hmm.
Um,
Yeah. Yeah, pretty
that's
much here.
good.
I'm working on my end too here. Okay, so so we're here live with Dr. Sandy Hilton from Chicago, Illinois, and she is a pelvic floor physical therapist at Entropy Physiotherapy and Wellness. And I've been following her and her partner in crime, Dr. Sarah Haig, for the last 6, 7 years now,
Yep.
and they are some of the few PTs I know who are up to date in the knowledge and practice with pelvic pain care while promoting science-based education as part of physiotherapists' CEUs. And so, Sandy, can you tell us about your classes and how you guys are conducting it? What is your format, and anything you want to talk about the classes that you and Sarah host?
Certainly. It was, Sarah and I, when we opened Entropy, we had this plan of creating a space where we wanted to be, where we felt like we could, like you said, put the evidence into practice and do what we thought was right with care, in an atmosphere that encouraged that. Because I know that there are a lot of therapists out there that are really trying, but sometimes the organizational limits get in the way. Um, and then a part of it from before we even opened was that it's so hard to get now, even more so, to get to all the places where really smart people are sharing that knowledge. And we recognized our privilege in being able to do that and thought, wouldn't it be cool if we could bring some of these people to Chicago to do small batch classes, in a comfortable environment that's fun and has good coffee and good food and space to spread out and be comfortable. You're not all crammed next to each other, um, and just really have a chance to dive into the conversations we always wish we had time for. So that's the model that Sarah and I were looking for. Sarah is the head CEO of courses at Entropy, so all credit to her for the organization of things. She's done a gorgeous job most recently out on social media of reminding everyone that the next course at Entropy is in June. Uh,
Hmm.
and and we're having 100% refund if people are signed up for something and we need to cancel it because of the coronavirus. Sarah calls it Corona canceled. Um, that people just get their money back. We're not messing around with what we know isn't someone's fault. So
That's good.
so we
That's
do
good.
have to take care of our education ourselves, our being able to help people, especially as the way we help people shifts in these times. But we're still going to need to practice with best evidence. We do have some online courses already on Entropy. So, like Neil O'Connell and Steve Camper's class is all recorded and can be purchased through our website. Um, we also have Neil O'Connell on his own with his Making Sense of Evidence course. Both of those are fabulous. And there are ways to still share information and learn, and even though we're being social by distance, we can still get this getting better all the time.
Sounds awesome. So, what are you in charge of? Hashtag endless coffee?
Hashtag endless coffee. Yeah, that's me. Um, it's always teamwork there. I just like to give Sarah the credit for the hard work she does in the back end, because I think people don't understand how if you do it well, it looks like it didn't take any effort at all, but that just shows you how hard a person is working.
Yeah. So the reason why I have you on here is because we talked about this earlier a little bit about because the whole concept of telehealth has been popping up all over my newsfeed on Twitter
Hmm.
and Facebook among physiotherapists and other physicians who are covering this. And so I'm curious. I haven't really looked it up online deeply enough to understand it. So can you tell us the for
What
people who
telehealth
don't know
is?
No. Yeah, it's basically. Oh, you're funny. It's basically, how what is telehealth, and I mean, it's basically like what it is, and why would a patient and a physical therapist would use it.
Right, and that's a really really good question. Just can yeah yes okay I can go online and I can talk to you, but why should I? Um, and it's frankly that's one of the things my patients right now are saying because I do a fair bit of manual therapy in my practice, touch that feels good that encourages people to start moving. So convincing people to use our online option to problem solve, to come up with ways to help themselves when they can't get out to get to help, um, is really the essence of what it is. It's still face to face. So as I'm having these conversations with my patients in real time right now, is look, we spend a fair bit of our time when you come in talking, and we can sit 6 feet apart there, but we can also stay in our homes and be containing things and slowing things down right now. And it still gives us that opportunity to look at each other because there's a video component to this. I do not record the sessions for privacy purposes, and compliance, and I would have nowhere to store them. But we are looking at each other. We are talking to each other and making eye contact, and all of those things that help a person feel heard still happens with online health. Um, and and the cameras have great range, so can even like demonstrate exercises and problem solve how you could do your own self-treatment techniques for manual therapy. Those are all possible, um, and work well if you organize your space well. So for the clinicians that are looking at doing this, just make sure that you've thought out ahead of time what you're going to need, so there's not a lot rushing on and off camera.
Okay, so is this covered by insurance?
Some insurances are covering telehealth, yes, and more are every day because the demand is huge. And the people are going to need to check with their individual insurances, and clinicians are going to need to check with their individual states and
Hmm.
carriers. Now, I am very lucky. Sarah and I, through Entropy, are predominantly a cash-based practice, so I don't know
Okay.
what's going on in Illinois because I I don't have a contract with a private insurance company. But I do know from looking online and the work that's being done through the American Physical Therapy Association and some other groups of trying to get it covered. Medicare is slow to allow physical therapists to treat through telehealth, but they have switched for their physicians to be able to do that.
Okay. Okay. Now, do you now? Um, I should interview an RMT for this up in Canada, but but at the moment I don't have it. So now there are some registered massage therapists up in Canada, like in Ontario and BC, who are legally able to incorporate exercise
Hmm.
recommendation for the patients. Now, could this be done as well,
Yes.
outside of legal,
Oh,
boundaries?
well, yeah, certainly following your licensure rules. Yes, because that's part of the problem solving, right? That's what we do as therapy is how are you going to keep yourself healthy? Well, let's do some exercises and movements that are going to keep you healthy. And again, it's a video interactive environment. It's not a recorded thing that someone's watching. It's a live discussion between two people through an online
Yeah.
portal. Um, so you can
Okay.
be doing squats and demonstrating overhead activities, and um, it, there's even ways that people like Chris Johnson and some other Tom Goom have been doing online consults with runners of just I think Julie Weeb's done this as well of
Hmm.
get a video of someone, so have someone video you run back and forth in front of them, and then send it to me, let me look at it, we'll watch it together and talk about it.
Okay, that's
um,
cool.
so there's all kinds of ways we can use this, um, and it's been being done. This is one of the things that I think this has kicked me into doing it more because I've wanted to, but I haven't needed to.
Hmm.
um, and and when people can come in, then why would they not? And but there's so much that I've wanted to be able to do this because there's people who can't come to therapy when they have sick kids at home or they're taking care of a parent and then their kids have to have get shuttled and they just don't have time for one more appointment. When we can use the online options, that gives all those distance and schedule problems get so much easier to manage.
Mm-hmm.
So I'm hoping that the changes that come from adjusting to the COVID-19 halting halting the spread, the flattening the curve effort, I'm hoping that the changes come out of this persist, because I think that it's a hugely important and powerful tool for people who have been needing it all along and couldn't get it. People with disabilities that can't negotiate the community very well, or it takes them an hour and a half to use public transportation to get in to an appointment, when there's so much we could do online.
Mm-hmm. Yeah, this is pretty an eye opener right now for me, because I'm thinking about some of my clients actually who are in persistent pain. They could benefit from this, but they don't know anything about it. So could we do a role play session right now by any chance?
Sure. Yeah.
Because just want to see what it feel what it get an idea what it's like. Now we don't have a video right now because basically this is all audio only. But um, let's
Well,
say yeah, go
I'm
ahead.
just I'm gonna interrupt you for a second, because there's people that don't have internet access, or stable internet access, or private internet access. So you don't always gonna have the video option,
Mm-hmm.
and this can be done with, old-fashioned phone calls too.
Oh, sweet. Okay, so let's do an old-fashioned phone call then. How's that?
Yeah, you have to
Okay,
make the.
okay. Now let's make up a disease for me. Okay. Well, what do you think would be a good one?
Oh, I think you should have. Do I get to, do I get to be nice or not nice with
You're
this?
the expert. You're the
Well,
expert. So that's why I'm
you
asking
know
you.
your body better than me,
Oh,
so I'm not going to tell you what you have. Why don't you tell me what's bothering you?
okay. How about well, pelvic pain, pelvic health, sciatica. I don't know what incontinence.
That's okay. I was going to say that's an easy one. All
Because I
right.
remember, yeah, well, easy one for you, yeah, but but yeah, because I saw a couple of posts about male pelvic health and also
Yeah.
about incontinence, because a lot of guys don't talk about it and they don't want to share it with even with the doctors.
Right.
So
So yeah,
now for
that would
somebody,
actually be a really good
let's
thing.
say okay, let's say I'm okay. So let's say I do have long term incontinence, and right now I'm in a lockdown, and what next?
Okay. Well, first I want to acknowledge that that's a hard thing to be dealing with at any time, and I can really see how, if you're stuck out of your routine and can't get out for supplies or whatever, this could go from a slight inconvenience that you work around to, I really need to change this. And now this is bubbled up to the top of my to-do list.
Mm-hmm.
Um, so to that acknowledgement, it's been going on for a long time. So what I want to know is what that means. Tell me what your peeing schedule
Oh
is
boy.
during the day and at night. Do you ever get up at night to pee?
Occasionally, yes, I do.
How many times?
Once or twice in the middle of the night, but that's too much already. I mean, it's been going on for about a year.
Okay. Is there a pattern to it that you know of? Like,
Mm,
if you stay up late and you're drinking a lot of tea before you go to bed, so you wake up halfway through because your bladder's really full.
oh no, my doctor told me not to drink any type of fluids that would stimulate a diuretic response. So no coffee, no tea, no soda, just water.
Just water.
Yeah.
When's the last time you drink at night before you go to bed? How much time between your last full glass of water and going to sleep?
About a full glass of water. Wow, that's a big glass of water. About 2 hours.
Okay, that's cool. And that last pee before you go to bed, how is that?
Usually it's like clear. I mean,
A
there's no
lot,
pain or
a
anything.
little,
It
clear's good,
var
but
it varies. Sometimes a little, sometimes it's like Niagara Falls. So,
yeah, fair. Um, and then when you wake up, do you wake up because you need to pee, or does something wake you up? What's going on then?
mm, Mostly it's just, my bladder tell me to wake up, you have to go pee, or else you're stay in the bed.
Okay. And when you do that, how much comes out?
Wow. It like I said, it varies. Sometimes it's a lot. Sometimes it's like, yeah, not so much.
Okay.
Is it similar to what pregnant women go through sometimes during like the third trimester when the fetus kind of like compresses against the urinary bladder?
It can be when there's not much space for the bladder to fill. That's something
Yeah.
that we need to fill out or figure out because there's a lot of reasons that a bladder
Okay.
can tell you that it needs to empty. Um, the This is when it's easier if you have video because I do a lot of hand um, gestures, but I can tell you that that's okay. You're not really missing out. We have some videos on our website that go over how the how the bladder works and what normal bladder fill is and the coordination of the pelvic muscles to the
Mm-hmm.
bladder. Sarah Haig's done a beautiful video on that's a great resource so that people can watch it and look at it.
Awesome. Okay.
And so I can talk a little physiology, but you'll also have that video as a resource to look at later when it stops making sense. Um,
Oh,
have Have you ever
I geek out
done?
on physiology. Yes.
Yeah, it's
Yeah, go
fun.
ahead.
Have you ever done a bladder diary where you've written down for 3 or 4 days what you're drinking, when you're drinking it, when you void, and how much comes out?
No, not really, but I kind of give a rough mental, I I don't give a diary.
Okay, so that would be a good thing to do.
Okay.
Since we're having a discussion about how to change this, is that's really good data to be able to figure out what's happening. And the doing it for 3 or 4 days also gets you just like a food diary. If you're trying to change how you eat, it lets you get an idea of what's happening, which is often different from what we think is happening, because humans are like that. So it's not a judgy thing. It's just a let's get a picture of what's going on, especially since things have changed and you might not be in your normal routine. So let's see what your bladder's doing now.
Okay.
And that would be a thing you can fill out. That's an easy email and you can fill it out at home. Now, typically we will have people measure their urine. If you're at home and you have one of those little hospital um, hats you can slip on your toilet and tells you how much you peed into, or a urinal you can use, or
Mm-hmm.
sometimes just a measuring cup that you're then not going to use for cooking anymore. Um, that you could do that. If you don't have those things, then just count the seconds that you're peeing for. It's not as accurate.
Okay.
Measuring's ideal, but I do understand that we'll do field expediency when we need to.
Okay. Thank you very much. Thank you very much, Sunny, for this little demo here. I think I get a pretty much good idea here, and I hope some of the listeners out there have already listened to this and get a feel for what it would be like, since this is a simulation of a
Right.
phone call. And I do feel a little odd because now here's the real me here. I don't have incontinence, but I kind of feel I'm getting there. Like there's a movie. What's the movie? Zoolander, I think.
Yeah.
Zoolander, where Ben Stiller's dad was, has incontinence. His character in the movie,
Uh
and he
huh.
was complaining about how his wait, is it Zoolander or is it something else?
I think
No, it is Zoolander. Yeah, he said my prostate the size of a walnut. So
right.
I was like, wait a minute, I think I'm getting there. I'll probably be like that in less than 10 years.
No. So, but it comes, and that's part of the physiology of things, right? Is like, and what we can really do with education is to say, you know what, our bladder also is, it, we train it. So if
Hmm.
you train it to be able to store and hold and be comfortable with it, it is better at doing that. If we're home, and this is one of the challenges for right now, is you can get some really lousy bladder habits because you're home and you might as well pee. It's right there and whatever. You're going
Hmm.
to go move the laundry anyway. And you start to get this habit of emptying your bladder before it's actually full. It'll start to tell you it needs to empty before it's actually full.
Hmm.
So, which is another reason why bladder diaries, though they're so simple, can pull out a whole lot of information. Um,
Oh, yeah. I really like how you started out with the interview with what does it mean to you? How what you asked a lot of questions and you let the patient come up with their own answers as honest as possible. Now, there were moments when I wanted to, like, don't want to disclose it, even though this is role playing, but
Hmm.
I had to like be honest and tell 'em I don't keep a diary. So,
No, but that's good because um, some people have done it. It's a standard, uh, should be a standard. If you're talking to any medical professional about continence, they should ask you to do that. But some people,
hmm
because they've already seen doctors, they've just done it, and they don't need to do another one. If they just did one within the last couple of weeks, they could just send it to me.
I
Um,
see.
so I mean,
So I
that,
guess, so I guess
it's
this could be done with other types of pain, like sciatica, with
totally
pregnancy problems,
all the
well,
pelvic pain issues,
even
golf ball
endometriosis.
sensation, that kind of stuff. Yeah.
Even endometriosis. That's a very complex one.
Endometriosis, so that's a process that causes pain that is we're going to be from a physical therapy perspective, what we're going to be doing is dealing with your symptoms and how can we mitigate the symptoms so you're more comfortable.
Mhm.
Um, so that's a series of questions and problem solving as well. And there are some self-treatment manual techniques that can really be relieving, and that's great. And I can teach people how to do that online. Easier
Mhm.
with video, but
Mhm.
but I can walk you through it with a phone call.
That's awesome. Now, as how many years have you been practicing since you graduated?
31?
31 years.
Yeah.
Has it all been pelvic health, or did you start with something else and then you?
No, I started in neuro. My goal in PT school was to work with spinal cord injuries, people who had spinal cord injuries and strokes and head injuries. Um, and then I was married to an army guy. I moved all the time, and by nature of the spinning the magic wheel of where you were moving and what jobs were available, I sort of migrated into orthopedics, and that's when I started doing pelvic health. And I always love saying this as I started in men's pelvic health because most people, when you talk to them, it's a women's health thing, and often because someone had a horrible experience themselves and they understood how much help was needed. I went into this completely sideways. I started working with men with sexual dysfunction, and then started asking why I wasn't seeing women with the problem, and that's how I got into it.
Okay, that's cool. And so for the PTs who are recent graduates, like within the past, let's say 6 months to 1 year, and we're having this coronavirus pandemic right now. And some of them might be interested in looking into telehealth.
I
What do you
totally
think?
encourage it.
What do you think they should be considering if they want that option? They graduated like 6 months ago or a year ago. They've been practicing, on the field for like a few months to a year, but now this thing hits. They're staying home, but they still want to work and help their existing patient.
I think they should. And the only thing we cannot do over an online system right now is touch people. Well,
Mm-hmm.
that was my cat jumping up onto a chair. That loud
Nice.
noise you just heard. Onto a
Okay.
bar stool. So the cat's actually much more coordinated than that sound. It's that the chair moved.
Mm-hmm.
Um, I don't want to like, what's wrong with your cat? No, he's fine. He just jumped up onto essentially a Bosu ball and stuck the landing. Um,
Nice.
the so you can't touch people, but and you can't do a physical examination is out. Um, but there's so much more that you learned in school about normal movement and normal physiology and critical thinking skills and problem solving skills and how to help someone identify their goals and then break that down into achievable steps. Those are all components that you come out knowing for any body part, ankles, knees, shoulders, helping people return to the activities they like. This can all be done online. You just
Mm-hmm.
need a stable platform, and by that I mean your video needs to still be stable through the whole thing, and it should be HIPAA compliant because we do talk about sensitive issues. And I know that currently in the U.S. there's talk about not being concerned about that, but I think we should always be concerned about that. So if
Mm-hmm.
possible, please stay maintaining privacy. Um, you're gonna need an area where you can do this that is private. So, I'm lucky. I have a spot in my condo that has good lighting, and no one's going to be walking around me, and I can control the sound as much as Chicago will let me.
No, that's good.
Um, Chicago and my cats, loud cats.
How is Chicago anyway outside? Is it pretty much locked down like here in California or?
Yeah. Yes, the Governor Pritzker and the mayor of Chicago, Lori Lightfoot, have both said, all non-essential activities need to stop, stay home. But looking out my window, there's still cars going out and about. You got to go to your grocery store to get food. Those are still open. The essentials like food and gas stations and um, probably some hardware stores. I think they were going to keep some
Mm-hmm.
that kind of stuff open as well because you still need to like take care of life. And so all of the people
Yeah.
that work in those settings are out and getting to and from
Yeah.
them. Um,
Yeah. So what are you doing to keep yourself occupied besides work?
Cleaning and organizing.
Ooh, that's all. That's a to-do list. You should see my desk right
Like,
now. Holy crap! Look at this.
oh, it's so like my place looks so much better than it did a week ago. Um, the I am going by like an archaeological dig through piles of papers and things. Um, I've used for years now. Dr. Bronnie Thompson taught me some years ago when she was working on her PhD a system of it's a time management system. And the book at the time was Pomodoro.
Hmm.
But it's a 25-minute focused activity and a 5-minute. I use it for movement system. So you set out what it is you want to accomplish. You decide how many units you think that's going to take, and then you go through that, and it helps you figure out how bad I am at estimating time required for a task. But
Hmm.
also, every every 2 hours, you get a half hour to go outside and walk, or do exercises in your house, or do something that's active and moving, and that really is helpful. So I've just been doing that,
Okay.
playing playing video games and watching anime and uh, things like that. Trying to stay off the news, but I'm a little bit of a news junkie.
Now, when you say you watch anime and video games, is this a new thing you just adopted, or have you been watching that for a long time?
Um, Anime about a year because my older
Wow.
son has gotten me into it. That was an
Nice.
intervention on his part because he thought that I was being a little too stressed and I needed to unhook from the world. So he started me watching these series that are in Japanese with
Uh-huh.
English subtitles. So I can't do anything else.
Hmm.
Like, can't just listen to it. I don't speak Japanese. So
I thought you did. I was kidding.
literally, nope. Literally sit and well, he can. That's why he watches them. Actually, that's backwards. He learned Japanese so that he could watch the anime when it came out and didn't have to wait for it to be dubbed or
Mm-hmm.
subtitled.
Wait, so he could. So does your does your son can actually go to Japan and communicate there? I mean, cause
I don't know if
he's
he's
be
that good. He's slow, probably like my French. Like,
okay.
yes, if they're patient and kind to you. Probably. He took it for 3 years at University of Michigan and then just keeps up with it.
Oh, nice. Okay, okay, that's good.
Um, Probably, I think that, like I speak flea market German. He probably speaks anime Japanese. I I
Flea
don't know.
market German.
Yeah, I can get lost and order food and find out how much something costs and learn a little bit about it, but I
Sounds like
can't,
my flea market Spanish. Okay, that's good.
right?
Well, thank you, Sandy, for your time here. That's all the time we have for today. And please check her website out. Can you tell people where they can find you and follow you on social media?
On Facebook, Entropy Physiotherapy and Wellness has a page, but there's also a Entropy Physiotherapy and Wellness continuing education page if you want to go look at the courses. We are on Twitter and on Instagram. And then I'm on Twitter mostly at Sandy Hilton PT, and Entropy is entropy.physio. And you
Sounds
can always check out the
okay.
website, entropy.physio. We don't have a .com on there because we switched because we like it.
Oh, okay, that's good. Well, thank you so much for your time, and hopefully I'll see you sometime after this whole thing
Yes.
is over.
We'll have a giant party in the future.
Okay, thanks for participating. I'll see you soon. Normally, I would end with a commentary about a news article or a research paper, but not today. I'm still recovering from a cough and sore throat, but I'm getting better every day. I've had it for about 3 days, and so far there's no fever or chills, so it doesn't seem like I have COVID-19 right now, but who knows? I'm still quarantined, and thank you everyone who are participating in quarantine themselves, and for all the healthcare professionals who are out there on the front lines exposing yourself to the risk. So thank you very much for the work that you do. In the meantime, I'll see you next time, and take care.